So hi, I'm Dr. Patel. I'm co-medical director here at Highlands Rehab Hospital, a part of the Vibra healthcare system here in El Paso, Texas. And today we're going to be talking about strokes. So what is a stroke? There are actually a couple types of strokes. There's something we call hemorrhagic stroke and ischemic stroke. So hemorrhagic stroke, fancy word of saying a stroke that's caused by an actual bleeding event in the brain, whereas an ischemic stroke is caused by usually a thrombus or like a blood clot that sometimes blocks the vessels into the brain, thus causing decreased blood flow and decreased oxygen going to the brain and causing a stroke that way. So there's different ways people can actually have strokes, and different things could put people at increased risk for both kinds. People who have a known history of aneurysms in the brain may have an increased risk for the hemorrhagic kind or the bleeding kind, whereas people sometimes who have other cardiovascular disease might be an increased risk for the ischemic kind. Symptoms of strokes, though, are very similar in both categories. You can have facial droop, change in balance, weakness on one side. Sometimes if it's a really bad stroke, it could be all sides. Slurred speech, change in vision, any sort of change in neurologic status can sometimes be a sign of a stroke. There's a lot of important things that you can do to prevent strokes. First and foremost, trying to stay healthy and active and controlling the medical conditions you do have. Things people may not think about, which is that cigarette smoking can actually increase your risk for strokes. So, cutting back or stopping smoking is a great thing. Making sure your blood pressure is controlled. Having high blood pressure puts you at an increased risk for strokes too as well. So things like that you do want to control. Other things that you may not think of is like something called atrial fibrillation or an irregular heartbeat can cause strokes in the sense that it can cause blood clots in the heart that can throw clots into your brain and cause a stroke that way. So what do you do when you do have a stroke? Obviously, you go to the hospital right away, call 911. Once there, they start the acute care of the stroke process. Where does rehabilitation comes in? Well, it's starting to come in sooner and sooner. People used to think that it came in after you left the hospital, but actually they're starting to do it even when you're in the hospital in the acute phase. Once patients are stabilized, there's lots of things that people can do. Sometimes just making sure that people are ranging arms, which is a fancy way of saying making sure that you have full range of motion of your arms and keep limbs moving, as well as positioning in beds, making sure that people have these things sometimes that we call prefos to make sure that people avoid something called plantar flexion contractures, where their feet get kind of stuck in a specific position. So there's a lot of things that rehab can do in the acute stages. And then based on evaluations from physical therapy, occupational therapy, and speech therapists, which are people who are a part of usually our rehab team, who specifically focus on different parts that might be affected by strokes, such as speech therapists may help with people who have different kinds of speech impairments. So the impairments may be based off what part of your brain gets affected. There's different areas in your brain that can be affected. So if an area where you do mechanical speech gets affected, that would be something we call Broca's aphasia. And there's actually a specific type of therapy that speech therapists can do called melodic intonation therapy, which actually helps people who have trouble speaking after strokes speak better. It kind of uses the fact that people have an easier time sometimes singing after strokes than speaking. So there's definitely different techniques that we use as therapy after strokes. And then there's also the physical and occupational therapy. Sometimes I hear it simplified in the way as physical therapy takes care of waist down and occupational therapy does waist up. It's a little bit more nuanced than that, but generally speaking, depending on what part of your brain gets affected, your arm could be affected more than your legs, or your leg could be affected more than your arms, or one side more than the other. So depending on that, you might have difficulty with walking, getting out of a chair, using your arm to feed yourself or dress yourself. So we can actually help not only work on those muscles to help hopefully regain some strength, but also to teach patients how to use different devices to make these activities easier should the strength not return. There's also different things you can do medications wise. You want to talk to your physicians about what medicines you should be on to prevent future strokes, depending on what caused your stroke in the first place. Also, there's always some interesting new studies out. There's actually a trial called the FLAME trial, where they tried patients who had who had motor deficits, basically meaning more problems with moving after strokes. And they gave one group a placebo and another group a medication normally used for depression called Prozac. And they noticed that the people that got Prozac actually did a lot better after the stroke. So there's other medicines, depending on what kind of symptoms you have, that you can also get started on. There's a lot more details involved than that in stroke rehab, but that's probably a good place to start.